So we've talked a bit about what some of the barriers are to getting treatment and maybe what some of a little bit about like what treatment could look like. And I will say with those processes, those could show up in ACT, but they could also show up in really just any really good therapist. And the therapists that have a theoretical orientation and sort of understand some of this sort of processes underlying wellness and maybe understand some of the research are going to be applying these things as well. But I want to talk to you a little bit because you've hired a lot of therapists in your life. You know, this isn't your first rodeo in terms of developing treatment centers and hiring therapists. And I'd love for us to talk about like how to find a good therapist, what we should be on the lookout for. And I want to talk about that from two different angles. One from the angle of actually what the research says, and then another from, maybe personal experience. And I can even share some of what my friends and colleagues have said about that.
Yes. Well, you and I we had talked about this before that when we look at what the ingredients are of effective therapy, a lot of times it boils down to aspects of the therapeutic relationship, and that carries a lot of the weight in the effectiveness of psychotherapy. And so, a lot of times, I think that people may look for someone who has a lot of credentials behind their name and who's really experienced. And although you definitely want someone who has good experience and operates using evidence based interventions, you also want someone who is relatable, someone where you're going to be able to have a good rapport. And sometimes that's hard to know. Looking at psychology today, it sometimes requires going and seeing a therapist, which it feels a little bit like online dating or something. You have to be willing to, once you've said, okay, I'm going to take the step to see a therapist, and now I'm going to go see that person. You have to be willing to either, if you didn't feel like it worked out well, go back or try someone else. A lot of times, people get discouraged with if that first appointment isn't everything that they'd wanted it to be. And so I always tell people, give it a second, an appointment, a chance before you make that decision that this wasn't a good match. But the match itself is really important. Um,
Yes, so certainly the therapeutic relationship is like central and it actually contributes to a lot of change that happens in therapy. You want to trust your therapist. You want to feel like you can open up. You want to feel warmth from them. You want to feel empathy and care. And your therapist just needs to be super skillful interpersonally. So if there's some that's just one of the things that actually maps onto the research in terms of interpersonal skills predicts better therapy. And like I said before, psychological flexibility of the therapist's psychological flexibility is actually part of that what they used to call non-specific factors, but is actually quite specific. It's actually a way of being in the room with a client that's really important. And yes, experience does not necessarily map on to outcome. Neither does degree, neither does gender, neither does age. Those things don't necessarily predict the effectiveness of the therapist. And another aspect that's kind of interesting about therapists is that more self-doubt the therapist has tends to be associated with better outcome, which is quite relieving.
yes, I know, that's very validating to me. But what,
Very validating.
yes,
Yeah.
but what that says to me is that people who may experience more self doubt are also people who may seek out more feedback and more learning opportunities. And so, what to me might be, you said your friend gave you a list of like when to run, I would not be attracted to a therapist who has all the credentials behind their name and hasn't really engaged in trainings or any updates, in the last 10 years or something. It's the continual learners who are keeping themselves competent and on the cutting edge that I'd want as a therapist. And I think it's those individuals who experience self doubt that may be more likely to do this. Steve Hayes says that experience predicts confidence, not competence. And it's not even just an adage, it's the research shows this. And the reason is that experience can sometimes occur in a silo. And when that happens, you're not necessarily getting feedback on what to change, what to do better, what worked, what didn't. And so maybe those individuals who experience self doubt are more likely to reach out in terms of getting feedback from their colleagues or peer consultation or to get additional trainings. And so that would be someone you would want to look for, I think, in a therapist.
Another aspect that I think is really important is the therapist being aware and conscious of privilege and power, and privilege and power in the therapy room, privilege and power in contextual factors that are influencing your life. So for a long time, therapy has been very individualistic in nature, right? Kind of like it's about how you're thinking and it's about how you're responding to your feelings, and sort of discounting the impact of things like oppression or stigma or all these other contextual factors that may be influencing you as you walk into therapy, right? Maybe you're in a workplace environment that's really contributing to your burnout, right? And also how that shows up in the therapy room. So one of those, the other run thing that my girlfriend said was, I run if a therapist sits behind a desk.
Oh, I would too.
And I was like, yeah, because there's a positionality there of putting yourself in a position of power. And I think it's so important in therapy. There's many layers of power. There's power differentials that we can, like in the room, for me as a white therapist, if I'm working with a client of color, there's privilege and positionality in that dynamic. And there's also just the power dynamic. If I have all my credentials on the wall and I'm coming in as an expert and I know, that can be really harmful to the therapeutic relationship. And it's so important that it's the client's goals and what the client's values that are driving the therapy, not the therapist. So that's another thing that you kind of can, it's sort of maybe more kind of sophisticated if you're looking for a therapist, but you'll get a sense of your therapist pretty, I mean, there's some of these are kind of intuitive senses of how you feel in the space. And do they have indicators on their website that are showing that they care about things like social action? Are they putting themselves out there in that way that indicates that that they're a safer place to go?
Absolutely. There may be studies that have been done on this, but in terms of like getting all the degrees on the wall and the desk, and maybe your chair's up higher and theirs is lower. I mean, all of these things that I think are actually reflect maybe some of the more inflexibility or insecurities of the therapist. And so it may be that in those situations, that's like a boundary that they have to put up to feel armored going into the situation. And so it that armor though blocks connection. And we're talking about really creating a culture at Lightfully that exemplifies the things that you were just talking about in terms of inclusivity and awareness. When I think about therapy, and we were talking about being seen before, and I think about this too for our employees. I want our client to come in. I want employees that work with us to feel that way, that they feel seen and that they are seeing each other and that they feel seen. And so being able to take into account our own privilege, our own lens through which we see the world, and understand that that sometimes can serve as a barrier to really seeing our clients or allowing them to feel seen, is of utmost importance of really establishing a therapeutic relationship or really being able to help someone and meet them where they are.
It's an I see you, I care about you. And also I think there's something in therapy that's about, and I'm not going to let myself get entangled in it. Probably I think one of the best therapists that I know, I will shout out her name, Liz Boyer. One of my really good friends, she's actually a sports psychologist and she works a lot with athletic teams. She's worked with like Olympic teams. And she talks about how as a therapist, you need to have this sort of view where there's enough distance to be able to see and talk about the patterns that the client has without getting sucked into the pattern itself. And you have to have that sort of awareness. So it's like, I see you and I see myself and I see the pattern between us and I see my own patterns, that my tendency to, have my own psychological flexibility. And you're juggling all of this at once. And it does take a level of self awareness. So one of the things that I look for in therapists is I kind of want a therapist that's done work themselves, and that you get a sense that like they've been through something. I don't want to know exactly. You don't have to tell me all the details of what you've been through and how you did it. We don't want that, TMIs in therapy. You don't want to have an over disclosing therapist, but you do get a sense of a therapist that has a sense of groundedness. They've been through something in their life, or they've done some work themselves, so they can speak from a place of greater depth and also know their own patterning and their own tendency to get hooked by their own thoughts or emotions.